It's time to imagine better health with CHI Health. It's safe to say the imagination of our next guest have changed lives.
He pioneered a procedure commonly called heated chemo. It's the difference in living without hope and having a great deal of it.
And we're pleased to welcome CHI Health surgical oncologist Dr. Brian Loggie. Good to see you, Doctor. And oncology nurse practitioner Holly Sennett's here as well. Thanks for stopping by.
Thank you.
For our viewers out there, doctor's been recognized as one of the best doctors in America. They provide this designation. Who provides that designation? How did that come about?
I don't know. It started when I was in Texas, and it's continued. There's several groups that list best doctors in America. So I've been on, I think, since 2001.
Other doctors are the ones who say,
other
right?
doctors
and
are the
patients?
ones that select. Yeah.
Let's talk about what you did a number of years ago. You started working on heated chemo. This idea. What inspired you?
I had a young woman, she was 35, two little children, and she had gastric cancer. And gastric cancer has a tendency to spread to the lining surface of the abdomen and pelvis, which is now what I, pretty specifically treat from a whole variety of cancers. In her case, we gave some chemotherapy up front. It worked a little bit, and then it stopped working. It kind of really poisoned her. And when I re-examined her, put a scope in, she had disease that we could see. And at that time, that was early 90s, that would be 91, we had no treatment beyond that. And that bothered me so much that I sat down for, it was about 6 months to draft up a protocol that would take advantage of surgery, take advantage of directly putting chemotherapy in contact with tumor cells. And so we started studies in about 1992 after we got permission. This was at Wake Forest, and within 5 years, we had a grant from the American Cancer Society, and we parlayed that into a grant from National Cancer Institute. And by about 1997, 98, we had a treatment, and we had 5-year survivors, which is something that we never saw before.
Because before it would have been a matter of months, right, for patients like the one that inspired you?
Yes. Yes,
yeah,
for the most part.
So there's this concept of heated chemo. Can you explain what that is? How does it work?
Sure. Well, it's very simple, really. If you work on a surface, like if we cleaned off this surface, well, with cancer it's a little bit more messy. You would want to wash that off, and then if there are any cells that are stuck to come back, we put chemotherapy in direct contact. And in fact, the only way you can get a higher concentration would be to take the tumor cells out and put them in a test tube with chemotherapy. And then the chemotherapy is limited in how much will get absorbed back into the body, so we can have very high concentrations of chemotherapy in direct contact, and we do that after the surgery, so we have as little tumor as possible left behind at the time that we do the treatment, and I think that's a big part of it.
When all of this started in the early 90s for you, what were your goals then compared to the success you're seeing now?
Well, my goals there were laughable. It was to see some 1-year survivors, and I would say probably over half the people we're seeing now, we're hopeful that they will make it to 5 years or more.
That's remarkable.
Our follow-up clinics are fun, Holly, because we see on a regular basis people coming back, 3, 5, 7+ years, and it's fun and it's very gratifying.
Yeah, and we're going to talk to Holly in a second. I want to get to this though, Doctor, because you've had patients that come from all across the country, and we've got a map just to show you how many patients you've treated. Where do they come from? Where are you seeing most of your patients?
We do see patients from all over the country. Most recently, we've had 2 patients from Louisiana. We do see a lot of patients from the Northwest. We see a lot of patients from the Midwest, including Chicago, and we see more and more patients from Nebraska as people hear about what we do and what options are that people didn't know about.
Holly, what is your role in the practice?
Well, I kind of touch the patients from the beginning to the end. I'm with them from when we're trying to decide whether they're a candidate for surgery to pre-surgery, discussing what we're going to do for the surgery. I see them in the hospital. I see them after the surgery and make sure everything's okay and release them to go home. And then follow up with them following that on email and phone.
I mean, you're really staying in touch with a lot of these patients. I imagine you hear all kinds of stories, some of them difficult, some of them heartwarming, I'm sure. Can you share anything with us? I mean, because really this is extended lives. It's allowed families to be with their loved ones longer.
Well, I think the most important story that I get is I want to provide hope. And, you don't look at just tomorrow. You want to get them down the road, and we take it one step at a time and do the best job we can.
I've heard some of your patients, they send cards all the time. Just like years later, you continue to hear from them. They never forget about the impact you make on their lives. Any of those notes still kind of pinned over your desk?
Well, Dr. Loggie has a patient that actually does contact him on an annual basis. Is that
Same age as my mother, and she says the same thing every year. She says, "I'm surprised to see that I'm still alive, but I want to thank you." Because you treated me way back when, do you not remember? And so that's actually very, very nice. As I said, in our follow-up clinic, we do see patients that have recurrences and things, and we'll be treating those. But we see a lot of people that are doing well, and that is just you know, it's very nice to see that when. You know, when I started, I have the perspective that we literally didn't have anything to offer these kinds of patients. So all of these patients have, what they have in common is tumors that have spread to the lining surface of the abdomen and pelvis. And it's taken a long time to develop the techniques and to learn how to treat that, but I'm very gratified.
Such important work you're doing, and we're proud that you're doing it in Omaha. CHI Health Cancer Center at Creighton University Medical Center on North 30th Street, and then online. If this message resonates with you or with anyone you care about, we encourage you to visit chihealth.com/abdominal-cancer-surgery, and we'll try to link that back for you on OmahaMorningBlend.com.
Yeah, I know a lot of people reach out to you through the internet, find out about your treatments on the web, and you just want to spread the word here locally. Have many of our local residents take advantage of it.
So good, Holly.
Thanks a lot
Thank
for
you,
coming.
Dr.
Thank
Loggie.
you very
A real
much.
pleasure to have
Great
you on the
stuff,
show.
yeah. It's a busy time.